Good morning. Thank you all for being with us this morning. I want to take a second and thank the media for joining us on our first virtual press conference that we've done here at Douglas County. It is our attempt to demonstrate how to practice social distancing and continue to communicate with the public as we do this work. Behind me and around me is a team of people that have been working pretty much day and night on this response. So the Board of Commissioners, myself, Commissioner Kress, Commissioner Boyce, along with our sheriff, our DA, and many of the local public health partners are here with us today. They've done a tremendous job doing this work, and as much as it continues, I want to take just a second and thank them for the work they're doing and how innovative they've been in that work. Douglas County is really proud to be on the forefront of testing. We're going to talk a little bit today about the pilot testing we did yesterday, and Dr. Dan Hoffer is going to get up and talk about that in just a minute. So I would also like the media to know that Douglas County has been engaged with the state partners at public health, the governor's office, the governor herself, along with federal partners. I just left White House briefing call where the vice president gave a briefing to local elected officials, and we're getting good communication at all levels of government. Our public health system here in Douglas County is a little bit unique in that we rely on and very much appreciate all the different partners that work together. So we have Douglas County has retained the public health authority, but we contract out the actual service work. Much of that work is contracted through Douglas Public Health Network, which is a nonprofit here in town. And those folks really are the frontline people doing this work. And we're really, really appreciative of the work that they do. But we also have other community partners as part of the board of directors and the service system, including the hospital, including the CCO, including the federally qualified healthcare centers, and many other partners that come to the table and help us do that work. So I'm not going to spend a bunch of time. I really want to get to Dr. Dan Hoffer, who is the Douglas County Public Health Officer. He's doing an amazing job. I'm not sure he ever sleeps, but we're sure appreciative of all the work that he does. And I'm going to invite him up now to speak to you. Thank you.
So thank you for that. I'm Dr. Bob Dannenhoffer, and for the press, that's Dannenhoffer. And I'm the Public Health Officer here in Douglas County. You'll notice this press conference a little different from other ones you've seen before. We are modeling perfect social distancing. People are 6 feet apart, is the way they should be, and only one person should be at the mic at a time. So it may take a little bit of time to get people up here if we have special questions, but please forgive us during this emergency. So I'm here today to talk about the COVID-19 situation, and most specifically about the pilot testing that we did yesterday. So we think that testing is going to be key to knocking back this epidemic. It was quite an event yesterday where we had so many partners helping, and I'm sure I'm going to forget people, but the Sheriff's Office, Douglas Public Health Network, Mercy Medical Center, and others helped us through this pilot testing thing yesterday. So for the last several years, we have done drive-through flu clinics. And we've done these at the fairgrounds or at fire stations where people could drive through, get a flu vaccine, and leave. And while that was great to help people with the flu, really it was in preparation for yesterday. So yesterday, we were able to conduct this drive-through clinic at the fairgrounds. People were registered before they got there. They were able to drive through, and in 3 or 4 minutes, they were able to get the test and be done. When we did the test, our workers were in maximal PPE so that they would not get infected, and we were able to use special portable personal respirators so that people would not be at all exposed to the germs. So it went great. We did 17 yesterday, throughput of about 3 to 4 minutes per test. And the reason and yesterday we did not invite the press yesterday because we wanted to be sure we had confidentiality. We know that some people who've been identified as having COVID or maybe having COVID have suffered some persecution, and we really didn't want that. So we did this yesterday kind of in secret so that people would know. Public safety was also very important, and we had the sheriff's office and others directing traffic. When you do drive-throughs, actually traffic safety is a big concern because people are nervous and we didn't want to get run over. And then we also wanted to preserve our PPE. So you could do these tests in doctor's office, but to do it, you really need to have very full protection. And every time you do every test, you'd waste one set of this. So I talked with a clinic elsewhere in Oregon, and they have 16 sets left. And they wondered if they should continue testing. And the answer is no, because if you use your 16 sets for testing, then you won't have it if you need to use it for a patient. So what we did yesterday, by using these special PAPRs, we were able to preserve protective equipment. So the testing is the best way for us to help control the spread of this disease. Right now, we don't know who has it, so we're flying blind. And I know there are a lot of people say, I'm sure I have it, but the Chinese experience and the experience elsewhere was most people who think they have it actually don't. But to help separate those who do from those who don't is going to be critical. These tests were done with a partner through Quest Laboratories. So Quest Diagnostics is going to be running those labs. It's a bit of a complicated story, but the labs went from the fairgrounds to the center in Roseburg. From Roseburg, it went to the airport. From the airport, it went to Seattle. From Seattle, it went then to San Juan Capistrano to be done. So we expect to get the results 2 to 4 days after they were sent. And this will then be some of the first large-scale commercial testing in Oregon and maybe even in the country. So we have wrap-ups. You can look at our website at douglaspublichealthnetwork.org. We have an active Facebook page at Douglas Public Health Network. We have a hotline, which we set up with community partners in town. This hotline is staffed by call screeners, nurses, and doctors, and they have the most up-to-date information. So if you call in, you can get up-to-date information. If we don't know an answer, and there are some questions we don't know the answer to, we will find it out. And then tonight, we're going to do our third virtual Q&A session on our Facebook page. So Douglas Public Health Network on Facebook. We're going to do live questions. We did this Friday and Monday. We're doing it again tonight. And we hope that people will submit questions. The one problem we've had is we got a lot of questions, and we're up for an hour, and we may not get to all the questions. But if you have additional questions, we will look at them and get back to people on those. I think with that, I'll take questions. So no questions yet. All right. We're having technical issues.
Think of something else around testing.
All right.
While we're waiting for
So we're having a little technical first virtual conference. So one of the questions that we got on our Facebook Live, which I think is really important, is we have this admonition not to panic. And so somebody said, "Well, Bob, that's not very helpful because panicking isn't a specific thing that I can do." And so we have some advice for people, specifics. So the first thing with panicking is don't go out and buy stuff you don't need. So there's this fascination with buying toilet paper, and I haven't gotten that yet because this disease has nothing to do with your bowels. So I have no reason to understand why people need to have a 6-month supply of toilet paper. So don't go out and buy stuff you don't need, because when people panic buy, other people see that, and then they too get panicked. So we want to be cautious with that. The second thing we say is don't spread rumors. Rumors are really hard at this. We have spent countless hours trying to track down and stop rumors. So for example, last week there was a rumor that there was a case of coronavirus in a daycare center. It was partially true. There was a case of a different coronavirus, which we don't worry about in the daycare center, but that then caused all kinds of concern. So please don't spread rumors. We have our hotline up for a reason. Those people can look at rumors and actually get to the bottom of it. The third thing we ask is be kind to the people who are running this. We're trying really hard. Tim says I haven't slept at all. I've slept a few hours. So, but this is our first pandemic. There is no one in public health who was there for our last real pandemic, which is in 1918. So this is our first pandemic, and we're trying hard. And I'm sure there's much that all of us have done that could be criticized. But please cut us a little break. And then the last three things is be nice to others. This is a time where there could be fist fights in the grocery store over the last roll of toilet paper. Please be nice to others. The other is to be nice to yourself. So this is a time when, we want people who are going to be at home to sleep in, get a little extra rest, and try and be as good as you can. And then the next is reach out to people who you might help. So during this time, there are going to be people, seniors especially, who we are asking to stay home. They could easily run out of food. They could easily need other things. So I would please ask people to try and help. So through your church, through neighbors, please go out and help. If people want to go on a website, we have it. It's called recovers.org. And if you go to recovers.org and click on Roseburg, it'll have people who need things, people who could give things. Please sign up.
Question, how long did each test take? And are you planning on opening testing up for other residents?
All right. So the question was, how long did each test take, and are we going to open it up further? So as we move people through, it took about 3 or 4 minutes per test. There were some that took a little bit longer because people had other questions, and we tried to answer the questions at the time. But we think we can move people through at 3 or 4 minutes per test. You can probably only be in that PPE for 4 hours at a time. You know, we had yesterday Tyvek suits taped on, portable respirators, no chance to go to the bathroom. So we don't think we can really ask testers to do this for more than 4 hours at a time. And so for each tester, we think we can probably get about 60 tests done. So yes, we think we can ramp it up. And then the other question is, when is this going to be available for others? So the test yesterday was a pilot so that we could see. We're hoping to get this up within the next week to have more widespread testing. And on this more widespread testing, we're going to open it up. Now, again, remember that you have to have a doctor's order to do this. So this is just not a show up and we'll do it. You have to have a doctor's order to do it. And the doctor's order then has to be done in a fairly cumbersome way that will explain to your doctor if you need it. Right now, I think we're going to limit it for people in Douglas County, but we've had a lot of interest from around the state to open up others of these so there may be more of these testing centers available.
What is the cost of the test and what's happening with people having to pay?
So the story is, what is the cost of the test and what are we doing with people to pay? So Quest Laboratories charges $199 for this test, which I will tell you is a very reasonable cost for the test, because other similar tests like this cost this much or more. So Quest, I think, has done a very nice job in pricing the test in a reasonable way. We've heard a lot from the state and the feds that nobody's going to have to pay for it, or there can be no copays or whatever. So we haven't figured this out. At this point, Quest is doing the tests. We'll figure out the money later.
How long it takes the test results to come back and who do they go to?
So the question is, how long does the test take, and how to get back? So remember, a fairly complicated chain here: Fairgrounds, Roseburg, Airport, Seattle, Quest, Airport, San Juan Capistrano. So there's a little bit of a lag there. We expect to get the test results back in 2 to 4 days. We did a test case last week to see how this would work, and we sent a test on Tuesday and got it back on Friday. So that's within the time. So we expect 2 to 4 days. We're told that the San Juan Capistrano site can process 10,000 tests a day, but as these test centers come up, they may also get overloaded. When the results come back, positive results will come back both to public health and to the ordering physician. Negative results will come back to the physician. We're asking the physicians, when they get these results, to contact the patients to let them know. Now, clinically, it doesn't change very much. So if you've got a cough and are not very sick, whether it's positive or negative, you should still do the same thing, which is stay home until your cough is gone. If the test is positive, we want to know about that, because then we'll go back and we'll look at the contacts and get the contacts tested. And that's the way other countries who've successfully handled this did this. They found the person who was infected. They found all the people they're at. They looked at those people. They looked at the people they were in contact with. And that's the way we can go ahead and get this under control. Without testing, if you try to contact everybody who's been around anybody with a cough, everybody would raise their hands because everybody's been in contact with somebody with a cough.
So can you emphasize again the process to get tested at this point?
Right. So the question was, can we emphasize the process? So the process is, to get tested, you need an order from your doctor. And so, if you're in that risk group, we would have you contact your doctor. What we were doing at the center yesterday was just collecting the specimens. So the order needs to go through your doctor, but still, we have not set up our next testing site because, as you can imagine, hundreds of hours of work went into setting this up, and lots of equipment and lots of other things. So this would be a great time to thank the Sheriff's Department. They help provide security as well as traffic control. Wayne Stinson was the incident commander and took care of it. Teresa is the person who has set up most of these flu clinics in the past, and she is maybe the world's expert on setting those up. Kristen and Laura are our epidemiologists, and they helped us with the multiple epidemiology questions that went. Dr. Jason Gray, who's not here today, was along with me swabbing the people. And for people who don't know this, this is not like, we had a number of people there yesterday, and they said, oh, I got swabbed for the flu last week. Well, the swab for the flu needs to go in 1/2 an inch to do this. When we're doing nasopharyngeal swabs get way to the back of your throat and are the highest yield test. To put this in, it needs to go in at least 5 or 6 inches. And most of the people said, oh, I've had this done before. Hadn't had this done before. Almost everybody who had it said it was a very memorable experience. Others who helped along the way, we've certainly had the commissioners who have been incredible with help. Think of how hard it would be to set this thing up, to get the sheriff, to get the fairgrounds, to get everybody there, and yet we were able to do it. So it's only through cooperation that you can get this done. So people say, let's set this up. No one organization could set this up on their own. You're really going to truly need a bunch of people working carefully together to get this done. All right. Okay, so I know not everybody could join us today for this, but if there are further questions on the press release, I think there's Vanessa's number and Tamara's number, so we can go ahead and get those out. Similarly, you can go to our Facebook page or our website. And again, I'm encouraging people to join us tonight at 6 o'clock for our Facebook Live event. The Facebook Live events have gone great. People are able to put comments and questions in at the time, and we'll go through as many questions and comments as we can get. With that, thank you all for coming.